Okay, I am doing this assignment on the first patient I had during clinicals, and she was my first care plan. Um, to give you a little backstory of a physical assessment that I did on her, she's ANO times 4. She has adequate vision, hearing, taste, smell, and touch. All of her senses are fine. She follows commands and speech is clear. She is English speaking. Her color is appropriate for ethnicity, and patient can make her own decisions on her own and about her care. She did rate her pain a 7 out of 10 when we asked her, and when we asked follow-up questions, she said that it was acute pain localized at her femur, and she manages it at home with oxycodone PRN. Prior to this admission, she was working on her stationary bike, and she was doing that twice a day for 45 minutes. Respirations were 16 breaths per minute on room air. SpO2 was 97%, and no adventitious breath sounds were noted. Depth, effort, and chest symmetry was all normal. I auscultated her heart, and I did note that there was S1 and S2 present with no murmurs. Her rate was regular. Her peripheral pulses were both strong, and her cap refill was less than 3 seconds. She had pinning edema +1. That was noted on both of her lower ankles. She does not use any TED hose or any devices of that nature. Her diet is tolerated. However, the patient is having increased nausea, and so when her meal tray was brought out to her, she didn't feel like eating. When I assessed her abdomen, she had hypoactive bowel sounds, and they were in the left lower quadrant. She uses a periwick, and her urine appeared to be very dark yellow, and there was no odor or cloudy urine. Description and explanation of the events that led the client to be under your care. Okay, so basically, the patient arrived to Mother Joseph Unit 2 due to a diagnosis of a UTI, and what led her to the hospital in the first place was falling off of her exercise bike, and she was brought here by ambulance. And she was diagnosed with the UTI and a never healed femur fracture from when she was a child. She also was diagnosed with diverticulitis and had reported constipation for a week. Describe the psychosocial aspects of the client, including social, financial, employment, all that good stuff. Well, the patient lives at home and is on disability. She states she's never been in love before and does not seek the desire to be in love by anyone. The patient is straight. She has had anxiety and depression since high school and does not feel comfortable in her own skin. In our conversation, she just stated that she was hopeless and overweight, and she just always suffered from panic attacks. The patient often thinks about her father and how he broke her femur as a child and was never properly fixed and stuff like that. But the biggest thing that the patient said to me was that she does not like to run errands for herself, and she barely likes to leave her home. And I'll touch on that later, but for someone who needs care, or not needs care, but like needs to get out more and become more comfortable in her own skin, you have to start by getting out of the house and out of that environment. Describe the team members involved in her care. So there was doctors, obviously nurses around the clock. PT was coming as I was leaving to assess what level she was at for mobility. Her past medical history, she had a bladder suspension in 2009. She has chronic back pain, obesity, PTSD, and acute kidney injury. The pathology of the diagnosis is, so she has a UTI. A UTI is a bacterial infection, and it is affected by the urinary system, including the urethra, bladder, and ureters and in the kidneys. Basically, the bacteria enters the urinary tract and through the urethra and then begins to multiply and then goes into the bladder eventually. If it is not properly treated, the infection, hopefully you're not hearing that. Let me turn on my do not disturb. Sorry. Okay. If it is not properly treated, the infection can ascend into the kidneys and then could lead to more conditions on top of that. Some risk factors with this is she's a woman, and women have shorter urethras, which reduces the distance of bacteria that can travel through the bladder. Intercourse can introduce bacteria into this urinary tract, decrease testosterone levels. So if she's postmenopause, she could be depleted in estrogen, which makes them more susceptible to infection. She also uses a periuic, and I don't know if she's had a catheter prior, but that introduces bacteria into the urinary tract pretty quickly. So some complications that can happen are like the urinary flow, and it just is not going to be urinary flow and stuff like that. Diagnostics is, urinary analysis is used to detect the presence of white blood cells, red blood cells, or bacteria. Urine culture identifies the bacteria causing the infection and then determines which antibiotic is to be used for this type of situation. There are imaging tests that can be identified for recurrent UTIs, like ultrasounds or CTs. I don't know if she's had any prior to this, or if it's frequent for her, but if it was, that could be the next step. So treatments is antibiotics, of the primary use is for UTIs. The choice of antibiotics does depend on the duration of, or the patient's health, the type of bacteria found. Also, with UTIs, patients can have increased pain, so taking over-the-counter pain meds to help with discomfort could help, but the most important treatment plan is just fluids to flush out that bacteria from the urinary tract, so either by mouth or by IV if she's in the hospital, but continuing fluids around the clock is going to be most effective, along with the antibiotic. Some complications would be recurrent infections, like we talked about, especially for women, and she does have acute kidney issues, so that is something to take note of. And nursing priorities for me would be monitoring urinary patterns by tracking the input and output of the patient, monitoring hydration, making sure that she has normal saline running around the clock, until she's starting to feel a little bit better and has more control over her urinary flow. And also, patient education would be really important in this scenario, because hygiene practices are good, completing the antibiotic course all the way through, recognizing the symptoms if they are reoccurring, and like preventing any catheter usage going forward. My short-term goal for this patient would be that the patient will experience decreased urinary frequency with extending voiding intervals to at least 2 hours. She was peeing pretty much around the clock, so if she could get that to where she can control her peeing episodes to at least 2 hours, that would be more beneficial than constantly just having moist area down there. It just creates more of a bad environment. And my long-term goal for this patient will be that the patient will demonstrate understanding of the UTI prevention strategies before leaving the hospital by verbalizing at least 3 preventable measures. I fear that this patient isn't very educated in UTIs, and she could benefit from understanding what to do, and I'll talk about that in a little bit. For my nursing diagnosis, it would be acute pain related to inflammation in the urinary tract, as evidenced by the patient has reported painful urination, some discomfort, and lower back pain, which is where your kidneys sit. So that is all inflammation response to the bacterial infection. My nursing diagnosis for the second one would be impaired urinary elimination related to bladder irritation, as evidenced by the common symptoms of urinary urgency, frequency, hesitancy, and cloudy, foul-smelling urine due to the infection, inducing inflammation that is disruptive of the normal bladder function, resulting in an altered urinary pattern and discomfort during elimination, which is what she's having today or that day. And my third, I added a third because I think she's deficient knowledge related to the lack of information about UTI prevention. When I had asked her a few questions, she kind of didn't know where to start or what to look out for if she was going to have a urinary tract infection. She didn't know how long this was going for. She just thought it was normal. So as evidence for this would be the insufficient understanding of UTI prevention, and then educating the patient on preventative measures like proper hygiene and all that good stuff like I talked about before. My concerns for her is with the proper hygiene. The patient is obese, and she likes to work out on her bike 2 times a day for exercise, which is great. But if she's wearing dark like leggings that she's sweating through, that could just be a bacterial happy place where that sweat is induced. That dark clothing and the tight clothing around that area when she rides her bike is not good for her. So understanding that if she is going to ride her bike, maybe some flowier pants or flowier shorts, and making sure that she's not so much sweat is going down there and causing that bacteria to form and lead her to the situation that she's at now. Discharge for this patient has really, really low self-esteem and can be lazy at times with things and not benefit her well-being. So I think that she could return to the hospital for the same diagnosis in the future. I think that she will deal with it for as long as possible before receiving the correct treatment that she needs, because she does not like to leave her house. I think if she hadn't fallen off her bike, she would never have realized that she had a UTI. So those are just my discharge notes. For advocate, I think that the patient would benefit from seeing a therapist. If it's just online, that would be even better because it could be from the comfort of her own home. I think she needs to unpack some of that trauma so she can get moving outside of her house and help balance that self-worth that she's struggling with. And my S-bar would be my situation. So I'm the nurse coming off shift, so this is my S-bar. The situation is a 59-year-old female who presented to the ER after a fall on her exercise bike. Her background is she has been diagnosed with anxiety, depression, chronic back pain, obesity, PTSD, AKI, acute kidney injury, and tobacco usage. The patient has had panic attacks while being here and prior to being here, so we did administer lorazepam PRN. Assessment would be that the last vital signs that I took were her BP was 129/80, her heart rate was 87, her respiration rate was 18, and her O2 sat was 97%. She reported pain being a 7 out of 10 before I gave her any pain meds. When I gave her hydromorphone by mouth and pregabalin with her morning meds, she rated her pain to be a 4 out of 10. The lab work did show positive for nitrate, bacterial/yeast, high BUN, so again, that kidneys is failing, the low glomerulus filtration rate, and high creatine levels. She has been receiving continuous IV fluids of normal saline running at 100 milliliters an hour at her posterior left forearm IV site. She has started her oral antibiotics to help treat that UTI and bacterial infection. My recommendation for this patient would just be continue with the antibiotic therapy, continue with IV normal saline, and encourage the patient to kind of get out of bed and get moving with her within her bedroom. She had a hard time even just sitting up on the edge of the bed, so I would just like to get her up and moving so that way it's not just her body just relaxing and not treating what it needs to be treating. I would also monitor vital signs, her eyes and nose, and get her nausea down so that way she can eat and give her nutritional benefits towards her body, and then reassess in 24 hours and see where to go from there. That is it. Thank you.